ultrasound study, that of a 31 years old male. What you are seeing is the upper and mid region of the right kidney. This is the total span of the right kidney that measures, let's say, if I all cystic type, I am not saying cysts, I am saying cystic type areas are seen throughout the renal parenchyma, whereas the kidney measures in length approximately 17.5 up to 11 centimeter is considered normal, whereas this is measuring 17.4 centimeters in length and some 7 centimeter in anteroposterior diameter, and anything above 5 centimeters is considered to be pathological, is not considered to be normal, at least if not pathological. However, the length may vary with the height of the patient, but the anteroposterior diameter should always remain the same, that is the 5 centimeter. Now here we see 7, so the kidney is enlarged both in length and in anteroposterior diameter. This is the first parameter that should have been noted first. Now, moving on, you see the outer surface of the kidney is regular, is not distorted at all. Here you can see this is the upper whole and mid region renal capsule. No irregularities seen in this region, neither it's seen in the lower pole. So the outer surface is regular. Moreover, if you see that the areas that are appearing as cystic areas does not appear to be of variable size, and they appear to be communicating with each other. Here you see they are communicating with each other. Moreover, going further into further detail, I see a dilated cystic area in the region of the renal pelvis, and this is the dilated renal pelvis. This area is the dilated renal pelvis, this region from here to here and from here to here. So measuring 7.6 into 5.7 centimeter is the renal pelvis, and from here onwards the proximal ureter is difficult to be traced because of the bowel gases. However, the proximal ureter is not dilated. Also, I am asking the patient to turn towards the left lateral decubitus posture. Okay, now this is the, if you see, iliopsoas muscle, this one, on the right side, the iliopsoas muscle, and you can see the kidney gliding over this iliopsoas muscle. Now, initially the ultrasound was performed with patient in supine posture. Now it is being performed with patient in left lateral decubitus posture. So as maybe if I can get the proximal ureter. Now now this is kidney, and you can see the communicating areas appearing cystic, and whereas in fact with, however, thinned out parenchyma. This is the total of the parenchyma that is visualized. This area. This is the anterior mid-region parenchyma. This parenchyma measures 6.8 in the anterior mid-region. So the parenchyma is thinned out. So the corticomedullary differentiation is muffled in this right kidney. And here you see this is the pelvis of the kidney, which just is dilated. Now this is the kidney of this area in longitudinal section, and this area is the dilated pelvis up to 6 centimeters. The pelvis is dilated. Now this pelvis is traceable up to the एक लंबा सा लेके सा रोको सा. I have asked the patient to take a deep breath and hold it so that I may get to the proximal ureter. Now you see here, this is the region of the proximal ureter salelo. This is the area where the proximal ureter will be emanating. Now it is seen that the proximal ureter is showing a stricture, is collapsed, and this is an important point to be noted. Dilated pelvis, okay. Reason: there is no calculus, no calcification seen within the kidney. No debris is significant debris seen within the kidney. This is the transverse section of the kidney, and the central sinus echo complex understandably will not be seen. Now there will be three differentials for you when you come across such a case. Is this a polycystic kidney? Number one. Number two, is this multicystic kidney? Number three, is this a case of pelvic uretary junction obstruction? PUJ obstruction leading to massive hydronephrosis and thinned out parenchyma. Now the differentiating points are that if this is a multicystic kidney, then the cysts are not too numerous as you are seeing in this case, and the proximal ureter is, the pelvis is not that much dilated, and the central sinus echo complex is not muffled to the extent as you are seeing in this case. Well, now if this is a polycystic kidney, then if these cystic appearing, now please I repeat that I'm not saying cyst, but rather I am saying cystic appearing areas will be of variable sizes, and the outer surface of the kidney will not be so regular. Humps and bumps will be seen, and the central sinus echo complex will not be seen, and there will be thickness of the dilated the cyst. Why this area is appearing as cyst is because you are seeing these thin thread-like linear structures. This is called the tipping sign that of the massive hydronephrosis. These linear structures, bright linear structures, and moreover, you will see that when I move the probe, these areas, cystic appearing areas change their shape and appearance. Now, I will go in favor of, in this patient, in this case, that this is a case of right pelvic uretary junction obstruction, where leading to, now you see this is where the proximal ureter emanates. So there is no dilation of the proximal ureter. There appears to be a stricture over here. This is the pelvis, dilated pelvis of the right kidney. And this is the iliopsoas muscle on which the kidney is gliding. And this is the basic cause of the remaining pathologies that we are seeing in the form of all the calyces being dilated massively. That's leading to the compromisation of thinning of the parenchyma, total thinning of the parenchyma at all regions, and along with it we see the dipping sign. Now these are called, in fact, these linear structures are called dipping sign, and are seen in cases of massive hydronephrosis only. So such cases one may easily report as being that of polycystic or multicystic. This is in fact a case of obstructive uropathy due to a stricture in this area, you see, at the region of PUJ, pelvic-ureteric junction, and this is the dilated pelvis of the right kidney, and these are the dilated calyces. No parenchyma visualized. The outer surface or the capsule is intact. No calcification or focal lesion is seen in this kidney. Now let's have a bird's eye view on the left kidney as well as the muscle of the urinary bladder. Now you see this is the left kidney. Now the left kidney is normal. This area is the left kidney, normal. See the area inside, and no cystic areas or hydronephrosis is seen in it. Now this is the urinary bladder in transverse section, and this is the urinary bladder in longitudinal section. This is the prostate. These are bowel gases. So this is our case of the day. Thank you very much.